Sibéal Carolan is a registered general nurse and a registered children's nurse and a registered nurse tutor and a fellow of the faculty of nursing in the Royal College of Surgeons of Ireland. From 2008 to 2016, Sibéal was a programme director for the Masters in Leadership programme at the Institute of Leadership in the Royal College of Surgeons. She's been working with the HSE Workplace Health and Wellbeing Unit from 2016 to date. So I'm very pleased to welcome Sibéal. So Bill.
Good morning, Una, and thank you. I'm delighted to be here today. I want to thank the INMO Occ Health Nursing section for organising our webinar today, and also to acknowledge the numerous sponsors who support this day. It's really, really important, and thank you. My presentation will be really short. I'm going to talk you through the development and implementation of the HSE Workplace Health and Wellbeing Unit Occupational Health Nursing Strategy. I was the project lead for this project, and the project was sponsored by Dr. Linda Sisson, who's the clinical lead for HSE Workplace Health and Wellbeing Unit. As you know, the HSE Workplace Health and Wellbeing Unit is responsible for occupational health services, the health and safety function within our services, staff counselling, and staff health and wellbeing. So it has been a very busy unit over the last year, and I'm acknowledging the activity within all of the units, both in the HSE, other sections, and private sectors as well. I know that the demands on services has been very significant as a result of COVID-19. And I suppose it's in that context that the timing for us to launch the HSE Occupational Health Nursing Strategy in one way couldn't be better. In terms of the project group, we had a really good project team with really good representation from our occupational health services, from our third level colleges, from our regulators, and from the INMO. So I want to express my thanks to the project team, and I'm going to shout out the names. They did Trojan work, and some are here today. Karen Bonner, Aoife Carroll, Alison Fraser, Anne-Marie Howard, Shelley Kane, Kathy Nolan, Marie Mahan, Maureen Nolan, Mairead Holland Flynn, Aisling Purcell, Bridget Quaid, and Maura Cagney. So their input into the occupational health nursing strategy was really, really key. We also had very significant contributions from Tony Fitzpatrick, INMO, and Steve Pittman. So again, thanks to the project group. So their terms of reference were to develop a strategy for occupational health nurses, and they achieved that. We went to a wide consultation stage with the Nursing and Midwifery Board of Ireland, with the Chief Nurse, and with the Office of the Nursing and Services Midwifery section within the HSE. So all in all, the strategy was developed through significant consultation and engagement. So once again, my thanks to everybody who was part of this project. In terms of the outputs, we have a document that will be printed next week, and it'll be circulated to all of our stakeholders. And there are 6 key themes within the document, and I'm going to just mention the key recommendations from the strategy. So the first theme is career pathways, and we've recommended that career pathways for occupational health nursing are progressed with agreed policies and regulations. So in the HSE, this will be through the Workplace Health and Wellbeing Unit. The second recommendation in relation to career pathways is that core competencies for each grade within the health nursing team is verified. So we know here in the HSE, we have approximately 90 occupational health nurses ranging from registered nurse grade to Assistant Director of Nursing grade AMP. So it's really important that core competencies are developed for each of those grades. The second recommendation is in relation to education. We're recommending that a training needs analysis is conducted for each occupational health service. We also are recommending that modules and postgraduate diplomas are designed with specific curriculum content that is relevant and applicable to our OCHealth nursing platforms. Another recommendation is to assess occupational health service departments as a potential setting for clinical placements for BSCN students and again in consultation with NMBI and again meeting the clinical learning environment standards. The third recommendation, the third theme, sorry, was really significant and generated significant discussion and debate, and that theme refers to governance. So in terms of the recommendations, we have two, and I'm going to highlight the first one, and that is to appoint a Director of Nursing for occupational health nursing within our HSE Workplace Health and Wellbeing unit. So that Director of Nursing will be the equivalent of a Band 1 level organisation. So this is key in terms of governance for OCHealth nursing. And we are all 100% clear about the importance of clinical governance and also professional governance as well. The second recommendation is that a senior nurse will be part of the Workplace Health and Wellbeing executive team. So again, this theme within the strategy of governance is really important. And again, it generated significant discussion and debate, and we achieved consensus at the end, which is really important. The fourth theme within the OCHealth nursing strategy for 2020 to 24 is to develop a workforce plan for occupational health nursing in collaboration with multidisciplinary team members, and to use the Department of Health integrated framework for workforce planning for health and social care. So again, that's a key recommendation. But also we've got to look at workforce planning specifically in the context of OCHealth. So what's the ratio of occupational health team members to healthcare workers? What's the capacity of our OCHealth services? And another important point, what's the skill mix? And how can roles be optimized within the multidisciplinary team? The fifth theme that we're making recommendations on, it's very straightforward. It's to ensure ongoing compliance with the Nursing and Midwifery Board of Ireland practice standards for nurses and midwives. And the second recommendation within that theme is to assess the compliance with the HSE standards for occupational health services, which were developed in 2018. And several of our departments have measured their compliance with those standards already. The final theme is to look at research, where we want to develop a research plan for occupational health nursing to include data, again, that is relevant and applicable to occupational health settings. And we also want to develop a forum for sharing and communication of relevant research and data to the occupational health setting. So they're the 6 themes within our OCHealth strategy, which will be launched next week. The next point to mention is really key, and that is implementation. I'm happy to say that the strategy will be implemented by the Clinical Advisory Group within Workplace Health and Wellbeing Unit. That group meets on a weekly basis and has very good representation from our occupational health services throughout the country. It will be their role to ensure that the OCHealth strategy is implemented, and we will have certain outcomes very clearly identified. I have emphasized that this is an OC health strategy for the HSE, but I'm conscious that there are other sectors here today, and there's actually no reason why this strategy, while the majority of it could not be transferred to a private sector or to an independent sector. It really is transferable. So that is the occupational health nursing strategy, which will be launched and disseminated next week in a nutshell. I want to mention two other things because I'm conscious of the time, and I will finish on time. I want to mention the winter plans, which were released some weeks ago. Within those plans, our unit has been given funding for additional resources. So we have a recruitment campaign on for a number of posts at the moment, and they are all advertised on hse.ie. And those posts include CNM freeze, and it's a national campaign. And the Director of Nursing post will also be advertised on HSE as well. And we're also developing the role of the practice manager within our occupational health services. So they're key developments in relation to our recruitment and workforce plans. And finally, I just want to mention our other service, our employee assistance program, which is really key in terms of our frontline workers. We're launching an awareness campaign for our employee assistance programs next week. It's a free service and it's confidential. So really important to emphasize that. And you'll see more information in relation to that next week. So that completes my presentation, and I'm happy to take any questions, and I'm within time.
Well, thank you very much. I mean, I think that's excellent news for occupational health.
Yeah.
So, I mean, I think that's, you know, and I think even just your comment there as well about, you know, transferring that, you know, even into the private sector, I think that's definitely something that we should be looking forward to, you know, going into 2021. So there's just a couple of questions here that's come through there. So what type of things will the Director of Nursing focus on initially?
Yeah, great. It's a great question, and I suppose the important thing to say is this is a key post. This is a leadership position within the OC Health Services team. So there will be many competencies that the Director of Nursing will have, and there will be many areas that the Director of Nursing will focus on. The first one, straight away, is leadership within our occupational health nursing teams, representing occupational health nurses at various forums, engaging with stakeholders like the INMO and the Nursing and Midwifery Board of Ireland, engaging with them, engaging with the higher education institutes. So that is one of the key things that the Director of Nursing will be doing. Other areas, they will be implementing the OC Health Nursing strategy. They will be supporting our occupational health services around the country in terms of professionalism, workforce planning, standards, etc. So, I mean, the Director of Nursing, it's a senior post. So we are talking leadership, we are talking strategy, we're talking representation, etc. So straight away, they're the type of tasks, responsibilities that the Director of Nursing will have, and there will be a very detailed specification going into it. It will include integration with health and safety function, integration with employee assistance programs, etc. But the key attribute, the key role is leadership and representation. And I hope that answers the question.
Yeah, so that sounds great, Sibéal. So again,
you know, Sibéal.
Oh, Sibéal, sorry, Sibéal.
Sibéal, yeah.
Sibéal, apologies for that.
That's okay.
So Sibéal, I mean, that sounds great. So will the strategy then include a proposal for registration, you know, as an occupational health with the NMBI?
That's interesting, Una, that you've mentioned that question, and it came up a number of times within our OCHealth strategy group, and it was discussed at length, and we don't have a definite answer on that at the moment. In terms of having OCHealth nursing specified there, it actually will, that is one thing that will have to be negotiated with the NMBI, and I would expect that it will take some time. I would expect that there will be a number of other areas of nursing that will expect that if OCHealth nursing obtain it, there will be a number of other areas requesting it. And I suppose I'm not the Nursing and Midwifery Board of Ireland, so I'm not 100% optimistic. It's not my decision, but it will be one of the items that the Director of Nursing can progress, and in terms of level of authority, recommend, but it will need really significant data behind it, and it will involve a lot of changes within the Nursing and Midwifery Board of Ireland. I can't speak for them. They would have to speak for themselves.
Okay, thank you for that.
Is that okay?
That's fine, yeah. So look, just I suppose one last question, because I'm just conscious of time then. Will the research funded by the WHW, or do you see other mechanisms for funding?
Oh, there's like, very good question. There's lots of opportunities for funding. I mean, we have a number of options. We have a number of foundations which are available to all staff, and I'm part of a foundation, and we receive applications for research on an annual basis. There's large grants, there's small grants, there's seed fundings. It's it's in a particular organization, it's available to staff. We have HRB grants which are available, and a good number of third level colleges offer research grants, and so there are plenty of opportunities. But there's also an abundance of opportunities at local level in terms of really good audits, etc. And
Fantastic.
There's plenty of opportunities.
Great.
Absolutely.
That's great. Listen, thank you so much for that update. It's been inspiring, and for occupational health. So and thank you for all the work you and your team have done. Again, we really